Future Treatments: What Research and New Drugs May Bring, by Dr. Selva 4.1. Hope and Future. One of the most encouraging aspects of idiopathic pulmonary fibrosis, IPF, care today is the growing focus on research and new treatments. While current medications can slow disease progression, scientists around the world are working to develop even more effective therapies. Research into IPF is advancing rapidly. Many studies are exploring new drugs that target different pathways involved in lung scarring. These treatments aim not only to slow fibrosis but potentially to stop or even reverse it. Some experimental therapies focus on reducing inflammation, while others aim to repair damaged lung tissue. There is also growing interest in treatments that target the immune system. Clinical trials play a key role in this progress. By participating in clinical trials, patients may gain access to new treatments before they become widely available. At the same time, they contribute to advancing medical knowledge and helping future patients. If you are interested in clinical trials, your doctor can advise whether this is a suitable option for you. Another exciting area of research is personalized medicine. This approach aims to tailor treatment based on an individual's genetic makeup and specific disease characteristics. In the future, this could lead to more precise and effective treatment plans. There is also ongoing research into early detection. Identifying IPF at an earlier stage could allow treatment to begin sooner, improving long-term outcomes. In addition to medications, advances in supportive care are also improving quality of life. New technologies, better oxygen delivery systems, and improved rehabilitation programs are making a real difference. While it is important to be realistic, it is equally important to remain hopeful. The landscape of IPF treatment has already changed significantly over the past decade. What was once considered untreatable now has options, and those options continue to grow. Staying informed can be empowering. However, it is best to rely on trusted sources and guidance from your healthcare team rather than unverified information. It is also helpful to remember that research takes time. Not every new treatment will succeed, but each step brings us closer to better solutions. Hope is not just about future cures, it is about continuous progress. Many patients today are benefiting from treatments that did not exist just a few years ago. The same progress is expected to continue. In the final article, we will focus on preparing for the future, practically, emotionally, and with the support of those around you. 4.2. The Future: Research, Innovation, and Preparation. For many people diagnosed with pulmonary fibrosis, especially idiopathic pulmonary fibrosis, IPF, one of the most pressing questions is, what does the future hold? While it is true that pulmonary fibrosis remains a serious condition, the outlook today is far more hopeful than it was even a decade ago. Advances in research, new treatments, and improved supportive care are changing both the understanding and management of this disease. Alongside this progress, patients themselves can take meaningful steps to prepare for the future with confidence. One of the most encouraging developments is the continued refinement of antifibrotic medications such as pirfenidone and nintedanib. These treatments have already helped slow disease progression in many patients. Future generations of these drugs are expected to be more effective, better tolerated, and possibly used in combination to enhance their impact. For patients, starting and adhering to treatment early under medical guidance is one of the most important ways to prepare for the future. Research is also exploring entirely new approaches. Scientists are investigating therapies that target the underlying biological processes of scarring, aiming not just to slow fibrosis but potentially to stop or even reverse it. Early studies involving immune-modulating drugs and antifibrotic combinations are showing promise, offering renewed hope for patients and families. Another exciting area is regenerative medicine. Researchers are studying how stem cells and natural repair mechanisms might help restore damaged lung tissue. While still in early stages, this field suggests a future where lung repair could become possible. Patients can prepare by staying informed through trusted sources and discussing emerging treatments with their healthcare team. Clinical trials remain central to progress. Across the UK and globally, patients are contributing to research that is shaping tomorrow's treatments. Organizations such as NIHR support studies aimed at bringing new therapies to patients more quickly. For some, participation in a clinical trial may be a meaningful way to access emerging treatments while contributing to future care. Earlier diagnosis is another major advancement. Improved imaging and research into biomarkers are helping clinicians detect IPF sooner, allowing treatment to begin earlier. For patients, attending regular checkups and reporting any changes in symptoms promptly can make a significant difference. Technology is also transforming care. Remote monitoring devices and telemedicine allow patients to track symptoms and oxygen levels from home. This enables quicker medical responses and helps patients feel more in control. Simple tools such as keeping a symptom diary can also support better communication with healthcare providers. Preparing for the future also involves practical and emotional planning. This may include organizing medical information, discussing care preferences with family, and considering advanced care planning. While these conversations can feel difficult, they often bring reassurance and clarity for both patients and loved ones. Equally important is focusing on quality of life. Maintaining physical activity within your limits, attending pulmonary rehabilitation, eating well, and staying socially connected all contribute to better well-being. Emotional and spiritual support can also provide strength during uncertain times. Importantly, the future of pulmonary fibrosis care is becoming more personalized. Treatments are increasingly tailored to each individual, improving both outcomes and quality of life. While challenges remain, there is genuine reason for optimism. The pace of discovery is accelerating, and support systems are stronger than ever. For those living with IPF today, preparing for the future is not about fear. It is about being informed, supported, and proactive. With continued progress in medicine and a thoughtful approach to planning, the journey ahead can be one of hope, resilience, and purposeful living.